So today I'll be talking about varicose veins. So veins are basically the vessels which carry impure blood from the lower part of the body, the lower extremities to the heart. So basically it is the flow against the gravity. That's the reason the veins are given a one-way flow of valves which facilitates the flow of blood towards the heart. Secondly, it is the muscle pump, the calf muscles. If the tonicity of the muscles is good, it provides a good muscle pump so that the blood can be pushed up, which travels to the heart and then to the lungs for oxygenation. Apart from that, there is the tonicity of the vessel wall. So it's pretty elastic, and this is how, because of this, the because of the the good vessel wall power, the blood can be it can be put to the heart. So either of these three factors which I spoke about, first is the vessel wall which is elastic, second is the muscle pump, and the valves are responsible for the good circulation so that the impure blood does not pool into the lower extremities. So in case any of these things are affected, then the pooling of blood, it happens in the lower extremities. So the ankles are swollen or the legs are swollen, and this gives rise to a lot of, say, pain, soreness, cramps, as well as pain behind the knee. So these are the common symptoms of varicose veins. Also the veins, they become torturous purple blue. You can see them like they are swollen apart, and along with that there are tiny superficial spider veins which are also visible. So it's very important to know what causes the backflow. Say why there is stagnation or pooling of blood into the lower extremities. It's basically because of, say, few things which we'll be mentioning here. It's the constant standing position. So because of, say, occupation, because of the job of a teacher or a policeman, where you have to stand all the while. So because of the gravity, there is a constant pressure upon the vessel wall, because of which, and the muscle pump could be poor, because of which the pooling can happen. And also in case the patient is obese or there is pregnancy, because of which there is an abdominal pressure, which is an added weight or pressure upon the lower extremities, can result in varicose veins. So it's very important to know what is the cause of varicose veins. Many a times it's also genetic, so we can't do much about it, but we can definitely do management of these things by natural ways of, say, exercising regularly, strength training. Walking is very important because it's like very gentle and it improves the circulation and muscle tone. The side effects of varicose veins can be very immense. There could be varicose ulcers. So because of the unhygienic or because of the constant pooling, the vessel wall can give up and it can open up into ulcers, leading to redness and itching and swollen up skin. And then we also have, say, what we call as an inflammation of the vessel wall, what we call as thrombophlebitis. There could be DVT, that is a clot formation into the deep veins, which could prove very dangerous because these clots can travel to any organ, say heart or the brain, and can get stuck into a vessel which is of very a small diameter. It can lead to cardiovascular problems such as stroke. So it's very important that we tackle the problem in time and not allow the complaint to be there with the body for a very long period of time, because the complications can be difficult to manage. So it's very important that you maintain healthy weight and exercise regularly, plus any hormonal changes that you witness, you need to address to them. Also because of, say, certain hereditary issues. So if you are aware about it, it's better that you can do such preventive measures so that we can avoid the varicose veins to develop. Because if we treat it in time with medicines, or we manage life, and by, say, as I mentioned, proper exercising and good habits, definitely the prognosis would be good.